In tonight's Health Matters, we're visiting the Florida Medical Clinic to speak with Dr. Feldman about the importance of getting a colonoscopy. We'll visit the Trinity Spine Center and learn about using your own stem cells for back and neck pain. Dr. Nalin Shetty will explain how to alleviate your allergies this spring, plus you do not want to miss the alarming new facts about birth control. Florida Medical Clinic has 32 medical specialties, and today we're speaking with Dr. Dennis Feldman. He's from the Department of Gastroenterology. He'll shed some light on colon cancer screening. That's a very important topic in the prevention of cancer, so you and your loved ones will want to listen very closely to this segment.
Colon cancer is the second most leading cause of cancer death in the United States, and each year in the United States alone there are 150,000 new cases of colon cancer.
Wow.
There's 50,000 colon cancer deaths per year. By intervening with colonoscopy, we can reduce that number by 60%. Now, interestingly, colon cancer is very rare in people under 50 years of age, but beginning at about age 50, patients form polyps called precancerous polyps, specifically tubular adenomas. And these tubular adenomas, over several years of time, can develop into cancer. By performing a colonoscopy on an asymptomatic individual, we can harvest out these polyps and reduce the major cause of colon cancer, which is the colon polyp to cancer sequence.
What are the early warning signs of colon cancer?
Unfortunately, there's really no early warning signs of colon cancer. That's why screening protocols are so important. Long before cancer develops, these polyps develop and they progress into a cancer. If a patient presents to the physician's office with symptoms such as abdominal pain, weight loss, rectal bleeding, or anemia, specifically iron deficiency anemia, frequently the cancer is at an advanced stage. That's why it's so important for us to impress upon people that it's not appropriate to wait till they develop symptoms to investigate whether they have a risk for colon cancer.
Especially if it runs in your family.
Absolutely, absolutely.
What are the advantages of a colonoscopy versus other methods of this type?
First of all, a colonoscopy is more sensitive and specific than other screening practices that we could talk about. Firstly, it not only identifies a cancer, it identifies its size and its location. It also provides the advantage of seeing if there's any precancerous lesions in the colon, and not only provides a diagnostic procedure, but a therapeutic one, because as we said before, by harvesting out these polyps, we prevent potential sites that can eventually become cancerous locations of the colon.
For someone who is apprehensive about a colonoscopy, what advice can you give them?
Firstly, we usually try to encourage them to undergo the colonoscopy if they're medically stable enough to undergo a colonoscopy, because many of the alternative procedures, if they're positive, lead in the algorithm to a colonoscopy to further investigate the situation or to remove polyps. Alternatives that can actually save lives but are not necessarily as thorough or specific as colonoscopy include fecal occult blood testing, which now is also done with fecal immunoglobulin testing, which is more specific than the previous hemoccult studies. By detecting chemical evidence of blood in the stool in patients that don't have obvious perianal bleeding, we can detect colon cancer way before it becomes symptomatic and frequently when it's curable.
Dr. Feldman, you mentioned bowel preparation. What technique do you use? Some people use a lot of liquid, some people use a prescription pill or a Dulcolax. What do you prefer?
Okay, in most cases, preparation is key to a good examination. There's the difference between an adequate exam and an excellent exam is really dependent on the patient and excellent preparation. Preparation is a commitment. For someone who has impaired bowel function, sometimes a 2-day prep is much more preferable than a 1-day prep, which makes it less rigorous per se. In most cases, the large volume gavage fluid like Go Lightly or Co-Lightly is very medically safe and very thorough. It's sometimes arduous for a patient to take that. From a medical standpoint, it's the safest prep because there is no loss of intravascular volume or impairment to kidney function. Some of the more abrupt preps do have certain risks to the kidneys and for patients with heart failure.
So following what you just said, the cleaner you are internally, the better exam you'll get.
Absolutely.
And the better results you'll get.
Absolutely.
And there's no pain to a colonoscopy.
No, not with, you know, the instrumentation between the 1970s when these procedures developed and now have improved significantly. So therefore, the imaging is much more thorough. It can be done more quickly. The diameter of the instrumentation is smaller. The light is much more visible. The visualization is better. And quite frankly, the assistance provided by our anesthesia associates is much improved over what we had available before. So most people really say that there was little memory at all of the procedure, and there's really relatively prompt recovery. And as we talked about before, they usually remember the prep as the most difficult part of the examination.
Right. What factors should prompt someone to say, I think I need to go see a good doctor about my colon?
Okay, well, certainly patients should seek medical attention for colonoscopy if they have had a several-week history of change in bowel habits. They should certainly seek colonoscopy if they're noticing rectal bleeding. Even if their assumption is that this is a hemorrhoid or perianal bleeding, some of those stories lead to catastrophe. Those patients need an examination. They may not need a colonoscopy, but they at least need an anoscopy or a sigmoidoscopy to prove definitively that it's the hemorrhoids that are bleeding and not something that's mimicking a hemorrhoid, such as a rectal cancer or an anal cancer or a large precancerous polyp in the lower colon.
What resources are available to someone to find out more about colon cancer?
Actually, locally, the Florida Medical Clinic is available. I provide a series of lectures on colon cancer, and I'm happy to, in a forum atmosphere, answer additional questions and concerns that individual patients have about colon cancer. Nationally, there's the American Society of Gastrointestinal Endoscopy, the American Society of Gastroenterology, the National Cancer Institute are the main resources that I would direct people to that seek more information.
Dr. Dennis Feldman practices at Florida Medical Clinic locations in Tampa and Land O'Lakes. You should make your appointment today for a colon cancer screening. If you'd like more details about the Florida Medical Clinic, go to great38.com. Just click on Health Matters. Over 80% of diseases are complicated or caused by stress.